Hello. Good after. Oh, I want to say good morning. Tired I am. Good afternoon. I am your favorite doctor host, Dr. Pierre, board certified internist, founder here at drpierresblog.com, author, speaker, soon to be podcaster, bringing you another edition of the Lunch and Learn. Today's Tuesday. It is the 18th. Getting this show and moving right along. I think today is episode 33. I believe. Hey, Shonda, thank you for joining. I'm going to talk today about mental health again. Like I think we've touched on it quite a few times throughout our Lunch and Learns, but obviously with the events this past weekend, I definitely wanted to kind of hit home and really talk to the men who were watching, or of course I'm going to get plenty of people who also watch this as well, but definitely wanted to kind of hit home. Some of the events that happened over the weekend. Like I said, if you're unaware, we did have, hey, how's it going? That guy, I don't even know his name, don't even care. Who fortunately murdered in cold blood. That elderly gentleman, and he blamed somebody else, but a lot of concern for mental health disorder, kind of being a big background factor of why he kind of did what he did. I just saw a report that says he may have been found dead. I didn't get a chance to read it before he started, but definitely unfortunate. But of course, I'm on Facebook, I'm on Twitter as well. So of course on Twitter, it sparked another debate on mental health in general. A couple discussions. Mental health in general, mental health in the men, and mental health, especially discussion in black men as well. So I definitely, obviously, because I fit a lot of those criteria, I definitely wanted to kind of make sure I kind of gave my ones and twos on the subject matter. Again, full disclosure, like I said, I think I've said this before, my wife is a mental health counselor, right? So, I think I'm definitely more skewed on the mental health aspect and the sheer importance of it. In general, I get a lot of my patients on a day-to-day basis who not only are coming to me for, headaches, colds, and whatnot, but a lot of mental health issues, whether it be anxiety, stress, depression, and the whatnot. So definitely I get a nice, pretty wide range of disorders that I see in my practice on a day-to-day basis. But what I often see, and I'm pretty sure this probably holds true to a lot of my physician friends, and then even my clinician colleagues, especially in the mental health world, is that they tend to be more skewed for women, right? Like I'd probably say, especially in my practice alone, women probably going to be close to about 80 to 85%. Hey Jen, thank you for joining. About 80 to 85% of those who, when they come to see me, are coming specifically for like those mental health issues, right? And and it's not that 80 to 85% of women are suffering from depression, anxiety, schizophrenia, and so all these other things here that not only play a factor in the mental health aspect of it, but definitely will play a factor in the physical role. It's just that a lot of times I can't get my men to come see me. I can't get my men. Not only can I not get my men to come see me, I can't get my men to even kind of admit that we're at that point where a problem has arisen. And sometimes it takes, in my office, sometimes my patients, especially my male patients, it takes them like 3-4 visits, right, before they finally say, you know what, doc, I really, I agree. I have an issue. I have a problem, that I know needs to kind of be addressed from that standpoint there. So I definitely wanted to make sure, I kind of hit home, some of the factors why, right? Especially me being male, growing up in our society. And our society is a very weird. Our society is from, because if I have a bachelor's in sociology as well. So in society, we tend to suppress the emotional response of males very early, right? We tend to suppress them even when they're a little kid. We tell them don't cry. We tell them things like man up. A lot of these things that we don't really pay no mind. We don't really, we don't realize like what we're doing because most of the time it's been done to us when we were little. But we start at a very early age, kind of suppressing the emotional response for men, right? And so what happens? Men, they grow up and they understand that to be manly, And in that context, manly, to be manly usually means to lack certain emotions and feelings, right? Usually means to, have a tough exterior. And if you're familiar, especially if you think it's true, think about the women, right, who you think have a very tough demeanor, tough spirit. A lot of times they get quote unquote labeled as manly as well, right? So it negatively affects us in both genders, especially from a gender role standpoint. But definitely the men get hit hardest, right? So they grow up, they know they have to man up, they have to they have to act tough. They understand that showing any type of emotion tends to be portrayed as weakness. Any type of emotion tends to, even especially from a homophobic standpoint, because a lot of men tend to be very homophobic. From a homophobic standpoint, they tend to be seen as homophobic if they show some emotions at an early age in homophobic different ways. So we definitely have a lot of issues, right? A lot of issues of concern, right? So what do I do in my practice, right? What do? I think the first thing I do, especially for my men, right? And I have men who are clearly suffering from depression. I have men who clearly suffer from anxiety issues, clearly suffering from anxiety disorders, and all the DSM-5 categories. I have men who suffer from all of those, like textbook, right? But like I know very well, right? Like if I even approach it, right? If I even approach it in the sense of, hey, are you, and they understand the buzzwords. Are you depressed? Are you anxious? Are you this? Are you that? They automatically shut down, right? Because that wall that's been built up for them, that wall that's been put in front of them since they were little kids, right, is something that never goes away. So, the second you even approach them in a way where you can maybe even, knock down, quote unquote, knock down their masculinity, their defenses go up. So what I do in my practice, I dance around it, right? So I will say like, hey, I see, you're having trouble concentrating at work. I see you're having trouble sleeping. I see, you get issues where your heart's racing. I dance around all of the topics there, right? And then I say, well, then I branch it. I talk to them about their family members. Like, do you have any family members who may have these similar symptoms and similar issues in and of itself, right? And once I can get that type of rapport, again, like especially for the men, first of all, men don't like coming to the doctor's office anyway, right? So imagine a man who's coming to the doctor's office and you want to talk to him about mental health issues. That's almost like, good luck with that, right? So that's big, right? So like I build this rapport, and I never say those words, right? I never say the key depressed. I never say the key anxiety. I never say any of these things because I know the second I do, like I'm gonna get the automatic wall, right? So I have to talk to them, and I have to pretty much I dance around it, right? Like I tell them every sign and symptom classical for the disorder. And then I can say, well, tell me what you think, right? Because men, they still want that control factor, right? So I always say, well, you tell me what you think is the problem, right? And a lot of times, right? Even though reluctantly, a lot of times I say, you know what? Maybe I am a little bit down. Maybe I am a little anxious. Maybe I am, a little depressed. Maybe these are some of the factors when it comes to it. Because you have to kind of let them, right, come to the answer, right? Because if you try, especially from a physician clinician standpoint, if we attempt to try to broach these men with like, hey, I think you're this, I think you're that, you'll always get an automatic no. No, I'm okay, I'm fine. There's no problems there. Hey, how you doing? Thank you for joining. You always get those problems here. So it's definitely something that I am very mindful of, very cautious of when approaching a subject like this, right? Because you have a situation like what you have this weekend, right, where from what the reports I read, he went to friends. He went to family members. He said he was suicidal. He said he was having trouble. And what did they do? They kind of pushed him away. They dismissed it. They belittled it. They said you'll be okay. Like that's a very especially it is very, very common, right? Especially for men, right? We always tell men, get over it, be okay, stop crying. Again, we're bringing back all the way to childhood, right? So we're always rearing them to like whenever they get that emotion to suppress it very quickly. So I mean, imagine, right? Imagine, like what level he had to get to for him to finally say, like, "Hey, guys, I have a problem," And then for someone to turn around and say, no, you don't, see you later. No, you don't, sleep it off. No, you don't, you'll be all right. So what does he do? Of course, you're going to withdraw, right? Because, you've taken that huge leap, right? You took a huge leap just to be able to say, like, hey, I'm having a problem, and it's not it's not a cold, it's not, back pain, it's not this. It's like, no, I'm having a problem up here that I don't know what to do with it. And then, he's pushed out, he's shunned away. So that's where we're at. Right? So we're in a stage where now this person, this male, and again, I'm talking to my men. And reason why, again, I'm not talking about women, not because I don't need to. It's just that usually, from a societal standpoint, women's emotions are encouraged. Women's emotions are supported. So they're more likely to see me in office. They're more likely to seek help. They're more likely to, seek treatment and then actually take treatment. When that comes, right? Because again, it's one thing, right, to know that you're depressed, right? It's one thing to know that you're anxious, right? Again, like if I say, you're struggling at work, you're struggling with family, financial troubles, keeping you up at night, like all of these things here, that clearly means that you have some undue stress that you may not be able to support. My female patients, my women patients are going to they're going to go see somebody for help, right? Men, they're going to take it on the chin, right? They're going to, quote unquote, deal with it. They're going to internalize it until until they can internalize it, or until they try to totally forget, act like as if it didn't happen. So I think that's a big thing for us as clinicians, right? We have to be, especially the men, right? Again, I always ask. I have medical students who rotate with me. And they know I always ask everybody, what's their mental like, right? Like what's stress got going on with your life right now? Because again, it's sometimes it's just your physician, just someone close family member, just asking that question. We talked about it in a few episodes where some people are like the family counselor of the group, right? Some people who everyone kind of dumps their problems on, right? And no one seems to, dump it on. That happens a lot for men, right? For men, a lot of men become the counselor. A lot of men get problems dumped on them, but they never seem to have an outlet, to dump it back, right? They never seem an outlet to try to exhale and get off and not deal with some of the problems that they're dealing with on a day-to-day basis. So I think that's what's key for us, right? I think it's key for the profession here, because again, an incident like Cleveland, unfortunately, could have prevented, right? It could have been prevented, right? Like if one of the family members, right, who listened to his plea, took his plea, for the seriousness as it was, and said, you know what, I'm gonna get you some help, and I'm gonna be there with you while you're getting help. Right? Who knows what happened, right? But unfortunately, the cycle of suppression, the cycle of lack of acknowledgement, played a huge role in what happened. And I think, and this week, of course, now I'm on even more higher alert. This week, I'm making sure, like everyone who comes to see me, if you're coming for like a wellness checkup, I'm making sure, like, hey, everything all right at home? Is everything, are you okay? Like, again, sometimes, asking a patient, especially my male patients, are you okay, is enough, right? Because men, we want help, right? We're not stupid, right? We know we want help, but it takes so much for us, right? It takes so much for us to make that leap and take that next level, right? I know even for me, again, my wife's a mental health counselor, and even in me, I used to have problems where saying what was on top of my mind was just be suppressed, right? Because I was just so used to kind of deal with it. I was just so used to dealing with, as a medical student, I was used to dealing with the stress of being a pre-med student, the stress of having to pass every class, or you weren't going to be a doctor. As a medical student, having to pass every test and class, or you weren't going to finish medical school and even residency. Like, so that stress, is something that physicians deal with on a day-to-day basis. And if you're not ready to kind of deal with it, head on, it can eat you alive. I've had friends, I've had residents, I've had medical students in the past where like the stress was too great, like the stress was just too much for them. The thought that they had to be perfect, the thought that they had to pass organic, the fact that it has anatomy, physiology, or biochem, or pass the boards, or do well on a rotation, do well on an elective. That was a lot for him, right? And these are your trained professionals, right? Physicians, right? These are your trained professionals, and they're dealing with stress on top of it, and a lot of them don't know how to handle it, right? So let's take that away, right? And let's put it on the layman person who isn't trained to deal with everyone's stress, who isn't trained at dealing with high stressful situations on a day-to-day basis, right? Like imagine what they deal with, right? So I think that's why we have to be very, very keen and very mindful of what we're doing, how we're doing it. Because again, it's situations like what happened in Cleveland, shouldn't happen, right? It shouldn't happen, right? If and I think part of the blame is in the United States, especially in the United States, but I'm pretty sure everywhere, but especially in the United States, because that's where I have the place where I can kind of compare. Like, we do not really like mental health, right? We not only do we not like mental health, we don't respect mental health, we don't give mental health its just due. So mental health tends to fight, and I kind of talked to a lot of my clinician friends, my mental health counselors, social workers, and everything else. So they always have such an uphill battle that they have to climb just to get proper services. Like if I got a patient who needs to, see a counselor, if I have a patient whose child needs to see a counselor, sometimes it's very difficult just to find someone who they can see from that standpoint there. So it's definitely something that I think it has to be a collective effort on, but I think it has to start early, right? Like again, I want you to watch this video, send this video out to your friends and family members, and and just think about some of your actions that you're going to do today, right? Think about the next time your nephew, your little son, he starts crying and you tell him to man up, right? Like think about what that's doing. Like so, think about how he's getting that message over and over and over again. He's watching TV, he's being told to man up. He's on the computer, he's on the internet, he's being told to man up. He's at school, he's being told to man up, right? That's not going to be good, right? So if so he's gone through decades, and again, it is sometimes decades of having to quote unquote man up, and then all of a sudden, feelings become at the wayside, right? You don't have to feel this is a tough guy. He has no problems, and a lot of times they're the ones suffering the worst. So again, I didn't want to go too crazy. Looks like I did. I didn't want to go too crazy as far as our discussion today. I just definitely wanted to make sure I touched on what happened and what you guys can do, especially moving forward, because again, that's really the important thing, right? So moving forward, what can you do today? Talk to your male friends, right? Especially the male friends, right? Women friends need it too, right? But talk to the male friends and say like, hey, is everything going on right? Is there anything I can do for you? Is there any issues going on with life? Let me know, and just kind of let them know that they're here. Now, they may not come, right? They may not, the first time, right? And most of them won't, right? Because they do it in my office too, right? But they may not say like, oh, I'm depressed. Like they're not gonna say that, right? But as long as you continue to serve as that ear for them, eventually they'll come to you, right? So I think that's really the name of the game, right? Like reach out. And again, you don't have to reach out to 100. Just reach out to one. Just reach out to one of your male friends today. Let them know. Ask them, are they okay? And if they say okay, let them know, hey, if you're ever not okay, I'm here for you guys. So again, you're truly Dr. Pierre, board certified internist. This video will be posted on the blog later on today. I will see you guys Thursday. The exciting was actually going to be in Atlanta on Thursday for a medical conference, but I'm still going to be doing a lunch and learn kind of on the spot there. So I'll see you guys later. You guys have a great, blessed day. Bye.